Hi doctors! In this video I will talk about a case of premolars extraction. Valentina came to me asking for a solution to her problem. She has undergone orthodontic treatment for 2 years with a colleague, but her extractive styles were still present. At the beginning of her first treatment, she had an uneven smile, a severe deep bite, a class 2 profile, an hyperdivergent skeletal pattern, an increased overjet and V-shaped upper arch. The previous orthodontist took only photos and an orthopantomography, which reveals the presence of the KID 7.5. The colleague decided to do the extraction of the upper first premolars and of the deciduous tooth. This is Valentina when she came to me. She still showed an uneven smile, an overbite deeper than before, and big spaces between upper second premolars and canines, while X-rays analysis reveals tilted roots in extractive spaces. So, how did I improve the predictability of this clean check? First of all, by sequencing the space closure with a frog staging. Closing a space simultaneously by moving all the anterior teeth at the same time will create a posterior open bite due to bowing, caused by the lack of control of the vertical plane. In the lower arch, we have the upper eruption both of incisors and of canines. In this occasion, I think it's better to use a frog staging, alternating the intrusion of canines and incisors every 4 aligners. Remember that the clean check does not always reflect the final position we want to reach, and when we want to close extractive spaces, the overbite increases by an average of 4 mm despite ending at 1 mm in digital planning. This increase in the overbite is due to the relative extrusion caused by the lingual inclination of incisors during their retraction. We can avoid this undesired movement using bite ramps and overcorrecting the intrusion of the upper and the lower incisors. Remember to manage the loss of anchorage of the upper arch with intermaxillary elastics and don't move molars and second premolars. In case of first premolars extraction, the canine will tilt distally towards the space and molars and second premolars will tilt mesially, so plan an anti-tipping movement. Tilt molar and premolar crowns 10 degrees distally to increase the posterior anchorage and tilt the canine crown 20 degrees mesially as it has a greater retraction movement. Finally, attachments allow the creation of a complex 4 systems to achieve better root control. Remember that the time of bone present in the maxilla has different characteristics to the mandibular bone, which has a denser bone structure than the upper arch. So, the upper and lower teeth will not respond in the same way to the forces we apply to them. Furthermore, don't forget that there are significant differences in bone mineral density between races. In Asiatic, it is less at all sides than those of European race. So, these are the requirements for the technician, and total treatment time was 17 months with 5 days change intervals. Finally, let's analyze her final records. She had a smile arc and profile improvement thanks to the use of second-class elastics. Intraoral records showed the closure of the extractive spaces and improvement of arch shape, the decrease of overjet, and the resolution of the bite and second-class relationship. While in final orthopantomography we can see a right position of the roots adjacent to extractive sites. As always, this is the before-after comparison. Valentina was really satisfied with her treatment and this made me so happy. So, if you want to level up your skills in invasive orthodontics, join us on Smart Aligner Service.